So there are 32 teeth in your mouth, and unless you have had your wisdom teeth removed, they all have a very important role to play. But when it comes to an attractive smile, there are only 6 teeth involved, and there are more important than any other teeth we have in our oral cavity. So, namaste. Hi, I am Dr. Disha Kanungo from Dental Dost, and आज का हमारा topic of discussion is something very different from the topics we have had discussed before. So, the topic of discussion for today is the smiling six or the social six. This is a very exciting topic, and it is a topic which is very new. Like everybody knows, apart from those 32 teeth, there are 6 teeth which are very important, which are visible to us in our smile. A very wide smile. Some people have a molar to molar smile, some people have a 6 teeth smile, and this smile is what we are going to talk about today. So we'll wait for other people to join. We'll see. And how many people are concerned about this smile is what we are going to talk today about. So, the social six. A very important topic. We can see that some people are joining everywhere, YouTube, Facebook, as well as Instagram. So, what is the social six? The social six refers to the 6 teeth, the 6 teeth which are visible, and some people, just to improve their smile, they work on this teeth. The smile improvement can be achieved. So, what is a normal smile? The truth is, most people show at least 8 upper teeth when they smile, which means from molar to molar. But only 6 teeth show when you actually smile, and those 6 teeth are actually the teeth which are eating, and they control the appearance of your smile than any other teeth in your oral cavity, ensuring that you look attractive enough. Being are these teeth? Which teeth are these teeth which are showing up on the smile or while we are talking? Let's talk about that. So we have discussed this before about how many teeth we have in our oral cavity. We have a little idea about this. हमें पता है कि हमारे oral cavity में कितने दांत हैं एंड कौन से दांत हमारी इस स्माइल के रिस्पॉन्सिबल है. यही आज हमारा important topic है. So which teeth are actually involved? First teeth are maxillary central incisors. So just coming along to a previous path, what is maxillary? What is mandible? Maxillary teeth are the upper teeth and mandible teeth are the lower teeth. Very simple. So when I'm saying maxillary incisors, we mean ऊपर के दांत. Whenever you smile, आपके सामने के जो 2 दांत दिखते हैं, हम उन्हें कहते हैं central incisors. Center में दिखने वाले incisors. These are called maxillary central incisors. These are 2 large teeth, front in the middle of your upper jaw. All the upper teeth are called maxillary and all the lower teeth are called as mandible teeth. The position of these teeth, maxillary incisors की जो position है, वो हमारी स्माइल की मिड लाइन डिसाइड करती है. व्हाट इज द मिड लाइन? क्या आपकी स्माइल में गैप है या आपका दांत टूटा हुआ है? इज योर टूथ क्रुकेड? डू यू हैव सम गैप इन योर टीथ? Is your teeth overlapping another teeth? Is what decides the smile. The size and the shape of the maxillary central incisors says a lot about your smile. Being larger than any other teeth, they focus on the eye on the center of your smile. So the center of the teeth is what we are focused on when we are smiling, helping to ensure that the symmetry of your smile is completely perfect. The symmetry of your smile is equal on both the sides. जिसका मतलब है कि हमारी स्माइल बराबर से दोनों तरफ दिख रही हो. इन प्रॉपर प्रोपोर्शन ये टीथ को लॉन्गर होना चाहिए एंड वाइडर भी. So these teeth are supposed to be longer as well as wider. So these central incisors play a very important role when you are smiling. They create a very youthful impression, and if they are longer and the teeth next to them are called lateral incisors. So apart from these maxillary central incisors, our lateral incisors also show during our smile because they occupy so much space in our cavity. इतना स्पेस ऑक्यूपाई कर रहे हैं हमारे कैविटी में कि अगर थोड़ा सा भी डिफेक्ट होगा हमारे सेंट्रल इंसाइजर में तो वील स्टार्ट फीलिंग अ लिटिल कॉन्शियस अबाउट अ स्माइल, which is, come on, not a good sign. We all are very conscious about it. So these square central incisors on the upper side are called maxillary central incisors, and sometimes they are a little rounded as well, a friendlier smile, and they create a softer look for the smile. So this is called maxillary central incisor, the front two teeth, which are the initial teeth responsible for your smile. Next comes maxillary lateral incisors. These are the teeth on either side of the lateral incisors. So they're usually narrower than the central incisors, and they don't work in the same way. So, how much narrower depends on the character of the smile. The height of the lateral incisors also helps establish the character of the smile. So जैसे कि हमारे सेंट्रल इंसाइजर्स जो थे दे आर डिटरमाइनिंग कि हमारे एस्थेटिक्स कैसे हैं, हमारा इंप्रेशन कैसा है. The lateral incisors, they decide the character of your smile, how wide your smile can go. If they are significantly a little shorter, मतलब अगर वो हमारे सेंट्रल इंसाइजर थोड़े से छोटे हैं, हमारी स्माइल थोड़ी यूथफुल लगती है, थोड़ा क्लोजर प्रपोर्शन के साथ दिखती है, इक्वली डिस्ट्रीब्यूटेड दिखती है, which makes your smile look much more mature and reliable. So, just the significance of these teeth in your smile is what we're going to talk. Now, what are these maxillary canines? The canines are the cornerstones of your mouth. They're the sharp teeth which show up front. So these canines are next to the lateral incisors. So we have central, we have lateral, then we have canines. कुछ लोगों में these canine are looking very long and sharp. That is why I referred as cornerstone. And these are not long and rounded. So sharp canines usually give an aggressive impression, an aggressive appearance, while rounded ones they usually look more friendlier. एंड कनाइन का एक बहुत बड़ा रोल होता है खाना खाने में. सो द रोल ऑफ कनाइन फॉर ईटिंग इज वेरी इंपॉर्टेंट. दे हेल्प सपोर्ट द मसल ऑफ द फेस. दे हेल्प डिटरमाइन द शेप ऑफ द स्माइल. They also determine how well you look in front, including the lip line. So your lip line extends towards it. How the upper lip is crossing your lower lip is also dependent on the canine, on the teeth as well as the gums. एंड ये आपका एक डार्क स्पेस जो होता है हमारी स्माइल का उसको डिटरमाइन करने में हेल्प करता है. तुम्हारी स्माइल की जो एज होगी दे विल लास्ट अप टू दैट टीथ. अब we have talked about the teeth involved, which are maxillary central incisors, maxillary lateral incisors, and maxillary canines. Now, what can we do to improve this smile? The ones which people would likely work on. Agar you want to improve your smile, we have options like porcelain veneers. We have options like cosmetic dentistry for cosmetic crowns. So, by modifying these teeth, people dramatically include and improve their four teeth को treat करें instead of treating all the upper 10 teeth, even for the bottom. So it's better अगर हम front के upper teeth ही treat करें, whether it be by porcelain veneers, whether it be by teeth whitening or maybe bonding, and sometimes even Invisalign. So these help create a great smile. And to improve your smile, these are some short procedures which we're going to talk about today. Natural and lifelike options movement are chosen according to that. So these options determine ki how is your lifetime going to look like. An experienced and dedicated cosmetic dentist, a cosmetic dentist will take as many pictures and videos of your smile, determine your face, work on the edges of your smile, and then they will work best towards the goal to improve your smile. Your consultation will even include a before and a after picture, or maybe multiple pictures, which is able to determine everything between the difference of the smile. So now let's talk about a little about smile designing. What is smile designing? So the purpose of smile designing is obviously to improve and gain confidence of the patient. So a natural looking face might not be satisfactory to everybody. And when it is not satisfactory, according to your face shape, according to a person's lips, or the chin position, if it is fixed, people work on their smile. And the patient gets a smile which is much more compatible in front. So the patient has to be comfortable कि उनकी smile कैसी है. The treatment is very trustable way and it's a healthy way. In fact, it treats also other diseases like talk about crooked tooth or talk about stains or discolored teeth. Because the design does not harm teeth or treatment period, you can smile and get a very healthy and beautiful smile. Smiling is a very important need for some people, and some people will not smile enough or not smile wide enough because they think that they don't help supply that need to the people. They will help you improve the smile by different techniques, by different methods. uh, so when talking about the smile designing, we have different type of applications. Number one would be orthodont treatment, which is used to either simplify जो हमारे brookline teeth हैं उनके लिए, और maybe के दांत थोड़े भी आगे पीछे हैं उनको सही करने के लिए, even for the wrong jawbone. And then we have a teeth whitening procedure. So teeth whitening procedure mein we usually look at how yellow teeth can be improved according to your skin shade. So the color of the teeth is anyway determined by your skin color, and that is how they would determine for teeth whitening. Then we have porcelain fillings. So with this application, you can just put veneer crowns over the teeth surfaces, and that can work. Then we have an option which is called as a pink white aesthetics. This treatment is about application on the gums. So the teeth color and the gum color, how they are going along together, is how this is decided. Then we have a very common procedure called lamina veneer. So this is just the veneering which is done on the tooth surface. Then we have implants, and implants are like titanium screws which are placed in our jawbone, and when the teeth is missing, they replace those. Then we also have emax coatings, not something everybody has heard of. So this is a special ceramic veneer without metal. A natural and a realistic smile is what this helps in. This is what smile designing is all about. The last option which you could also opt for is a zirconium veneer. So, a porcelain without metal is what is zirconium veneer, and that is something that you can also work on. This is smile designing. We have something called as smile aesthetics. Now, what is smile aesthetics? What is aesthetics first? So, aesthetic is something how it is portrayed, how it looks like. Aesthetic का मतलब होता है कि वो कैसा दिख रहा है, and smile aesthetics means कि वो teeth क्या broken है, क्या वो unsound है, does it have a wrong color, does it not suit your skin color. So, a person's facial structure has to be considered for a treatment to be applied. Every patient of the teeth. So if a teeth has stains over it, हम के across जो surface होता है उसे clean करते हैं with a whitening gel. Then we have a crown lengthening procedure in which people very gummy smile, जिनके gums बहुत ज़्यादा उभर के दिखते हैं उनके दांतों से, हम उस extra gum को remove कर देते हैं with some laser procedure. And after that, fewer gum has been shown, which shows a longer crown. Then we have implant. Implant, like we discussed, the titanium screws. Also, we have orthodontic treatment, which can be used along with the implants. Then we have an inlay-onlay procedure. So, inlay-onlay procedure is just a filling procedure. This treatment is totally about how a tooth cannot cure a dental filling, and then you can just place inlay or onlay just to cure it. Then we have zirconium porcelain crowns. So, zirconium porcelain crowns are the one which are used to replace the, and that is how they are reassured about it. Also, we have laminated restoration. Then we have adhesive systems. We have gum surgeries. These are some other options which can help in including the smile aesthetics. So, in all, we all know the importance of a smile. We all know which teeth are involved, and we all know the things that should be done. How a cosmetic dentist would think about getting a treatment done for you. So, when smiling is done very often, people laugh as much, people show their teeth as much. Some people smirk, some people don't. Some people smile in a very kinder way. So, smile designing comes as a solution to that point. A person gets a very natural and a new smile with a design treatment. This treatment so much is preferred, and it's easier, costlier, itna nahi, and does not harm your teeth. So, teeth get again natural looks, colors, as well as they beautify. Smile is one of the most enjoyable things in the world, and that's why a treatment gives a very person a chance for a better smile, which is very popular these days. In this era in which we are living right now, living a very healthy, technologically developed community, we don't want aesthetics to be harmed. We don't want to look bad. And so many people have a clean, white, beautiful smile. And when we look at them, we get inspired that maybe smile aesthetics can actually solve our problems. So problems like broken teeth or decayed teeth, uncomfortable smiles, so smile aesthetics and smile designing can actually cure this problem. And you can actually on this key what might be the issue. A person who wants to smile does not want to feel shameful because they have a crooked tooth, because they have a stain on their teeth. Nothing is something which would make them feel ashamed. In that way, a person wins a pretty smile after the smile aesthetics and the smile designing to give a confident stance. And oral health comes with aesthetics. So, oral health does not just mean about treating your decayed teeth. Smile designing also comes in oral health, and beauty really hides in the healthy. So, beauty is determined by how healthy your teeth look, and a patient gets a chance to have a perfect smile with the treatment, and patient can know if the treatment has been done perfectly or not. They feel satisfied. So, what I see is that we have some questions. So, the first question that we received is, "Hi, my name is Kaushal. Please help with intrinsic stains right in the middle of my middle two teeth. How to help kids from trouble from teething?" Okay, so Kaushal, what I suggest you right now is the exact point which I was going to cover afterwards. What you can do is download our Dental Dose app, which is free and lower teeth, and the app would give you a diagnosis within 10 seconds, which is dentist checked. And when you receive that report, we have doctors sitting at our back end who would be providing you the report, who would be providing you the solution. And once all your questions and all your queries are answered, you can go ahead and keep using the app. Doctors are available 24/7 there. Anytime you have a problem, the helpline team is always there for you. So please go ahead and use the app. So you would know better. We have summarized everything in one place. And the doctor which is responsible for smile designing and smile aesthetics is the cosmetic dentist. And the treatment usually lasts for 10 to 15 years. So the most important thing which you have to remember are the teeth which are involved, what kind of treatment would suit you, and which kind of doctor should you refer to for the same. Till then, please stay with us. We are going live every Saturday, sometimes with other people, sometimes us and you talking about different topics. We will keep asking you questions. If you have any more queries, feel free to DM us over any platform, whether it be Instagram, whether it be YouTube, whether it be Facebook, and we will be available to you there itself. Also, download the Rental Those app. Take a consultation if you have a query regarding your teeth. Till then, keep with us. Thank you for joining. Namaste.